So at this point, I want to bring Dr. Walt, and he can talk about what you need to know about your blood work and what doctors may not know. Okay? Here's Dr. Walt.
Hi, everyone. My name is Dr. Michael Wald, otherwise nicknamed the Blood Detective, and welcome to this 14 or 15-minute health segment. And thank you, Alex, very much for continually inviting me to provide a segment every Wednesday. So you can join us here on the radio show every Wednesday, or you can go to my website and listen to the shows as well. They're posted at www.intmedny.com or blooddetective.com. So today's topic will be what you need to know, what you absolutely need to know about your laboratory work and what your doctors may not know that not only could save your life, but improve the quality of your life. Because what's the point in living longer if we live longer with disease? You know, in medicine, there's a fancy term for living longer with various health problems, and that's known as disease clusters. And that does not have to be the way it is. So how do we change that possibility? How can we improve the probability of living longer, but living longer within what's known as the non-disability stage of life, so you can participate in life? So I mentioned a moment ago that I was nicknamed the Blood Detective, and this segment is called Ask the Blood Detective. And basically, as I explained in previous shows, that was a nickname given to me by a patient years ago who I diagnosed with a health issue where other very intelligent and very committed physicians failed to do so. Now, why is that? Was that because I'm smarter than they were? Not necessarily. It really, I believe, came down to the perspective with which I viewed the patient. And that gets us to the topic of the show, laboratory work and blood work in particular. Now listen, all of us know what it's like to have blood work drawn. We've all had it done one or more times in our lives. They stick that needle in our arm, they pull out some blood, and then we get a report, and it's generally explained to us by our healthcare provider, generally our medical doctor. And many of those tests, which again we are all familiar with, like cholesterol and glucose and iron and hemoglobin levels and vitamin D levels, etc., are just part of the many thousands of tests that can be drawn. But have you ever thought about how those normal values that your blood results are compared to come from? In other words, who says that a cholesterol level anywhere under 200 is where we all should be for optimal health? Or for that matter, how was the glucose level defined, or the best chloride level defined, or the blood urea nitrogen, liver enzymes? How are these figured out? Because, you know, when you get your blood work done, your doctor says to you something like, your laboratory work looks great, and what he or she means, what your doctor means is that when he looks at the lab results, that your values from your blood test, when compared to these clinical ranges, they're known as clinical ranges, your values fall right within those ranges, either on the lower end or the higher end or somewhere in the middle. And no matter where you fall, if everything is in those ranges, no matter what symptoms you experience, your fatigue, maybe depression, you might even have cancer, autoimmune conditions, degenerative joint disease, you name it. If your laboratory work looks good, the doctor is sort of baffled. A light bulb should go on, not just in the doctor's mind, but in your mind. How is it possible that you could not feel so great, but you're told that your laboratory work looks pretty good? Well, here's one of the reasons. Those clinical ranges that I spoke about are based on taking a bunch of people, putting all of their different values together in an average and determining what the average cholesterol is, glucose, et cetera, and you are compared to that average. Now, have you seen the average person your age in the United States? What I'm getting at here is they're not particularly glowing with health. So I'm suggesting that perhaps there are better ranges that you may want to have yourself compared to, your laboratory work compared to. Now, if someone does not have iron anemia or iron deficiency or AIDS, for example, and they're seemingly well, they could donate blood work at any Red Cross or other blood bank or blood center. And all of those values of the different lab tests are run on your blood and everyone else that's donated blood, and an average is determined. And those results are very, very wide because, as you can imagine, the results of these different tests among a wide range of people in a population are quite different. Blood tests are considered relative to whether or not we're talking about a male, a man, or a woman, or a child, a girl, or a boy, and there are different ranges there. And if things pop out on the high end of the range or on the low end of the range, and enough of those abnormals happen in a certain combination, we call that a disease. Now, common sense would tell us that before laboratory work just pops out and we have disease that every doctor could agree upon, yes, this person has this disease, there is the dis-ease phase. That phase where problems start, but you may not be aware of them, or you might have subtle symptoms, but they may not be severe enough that the sensitivity of your blood work picks it up, and your doctor, who is disease-oriented and not health-oriented, may fail to see. So, we describe our healthcare system as just that, a healthcare system, but it's really a disease care system. Now, I don't mean that as a criticism, but I just mean it as an observable truth. Health is not taught in medical school. Nutrition is also not taught much. The average physician has roughly 23 hours of very, very basic nutrition education, which means, according to a quote, an observation from Harvard, that the average individual who watches television commercials probably knows more nutrition than their medical physicians. So I'm bringing together here the concept that better health, possibly a longer lifespan, almost certainly a better quality of lifespan, and I refer to that as living in the longer, the non-disability stage of life, is associated with different normals, different clinical ranges than your traditional doctors are trained to investigate or even acknowledge. Now, there's also a big difference, as you know, from one medical specialist to another. The endocrinologist knows his or her limited area of the body and tends to draw specific laboratory compartmentalized testing. And the same is true for the endocrinologist, the hormone doctor, the OBGYN, the gynecologist, the internist, the family practitioner, the immunologist, the neurologist. You get my drift. Now, in the integrated or holistic healthcare field, of which I characterize myself as being a part of, I draw laboratory tests in most every area that I just spoke about and others at the same time on each patient, usually regardless of their healthcare problem, if it's chronic and they haven't been helped by other practitioners who have done the limited compartmentalized laboratory work and who have interpreted laboratory work relative to those regular clinical ranges, remember, which I said are based on average people. The average rate of disease is way too high. So clearly, if someone is not feeling well and they have just outright disease and laboratory work does not reflect it, if your doctor says, as I've said a few times during this talk, well, your blood work is normal, so maybe you're depressed. Have you heard that before? I hear that a lot. People tell me this. This is what their doctors had said when they cannot make sense of what's happening with the patient. I submit to you that perhaps traditional medicine fails to make sense of what's happening with people because of a few reasons. Number one, their paradigm is disease-oriented. It's not dis-ease-oriented. It is not health-oriented. That's sort of asking a person who speaks French to interpret Italian who has no training in Italian. No matter how good they are in French, they can look at the Italian, written on the page, but they just cannot make sense of it. So medicine has a different language which allows them to have a certain perspective on information. So that's why someone would come to me and I might look at their laboratory work, even limited laboratory work, and find things because of how I interpret it based on different ranges based on healthy people, where traditional doctors have missed it. Now, this is the first time I'm mentioning this. There are different clinical ranges which are based on optimal values, where best is that vitamin level which is associated with reduced risk of all causes of morbidity and mortality, for example, not just it's in the range. Let me give you a practical example. Vitamin D. we know that the vitamin D blood ranges between 30 and 100 on average. Most people will fall within that range. But there was a study on many of the good vitamin D studies to determine what does it mean, because this study says one thing, the other study says this is the right range. How much does the individual need? Well, on average, and listen to this is true, the higher normal your vitamin D level, the lower your risk of dying of anything, particularly cardiovascular disease. So if you have a 31 vitamin D level or a 40 or a 50 or a 60, well, that's okay, but 70 is the minimum you should have based on real study. And many of you are thinking, well, I take vitamin D or I take vitamin C and I eat this way and I eat healthy, so my lab should look great. That's not true. First of all, you're not what you eat. You're what you absorb from what you eat and how you utilize things. So laboratory work is absolutely essential, and comparative laboratory work over time to really know how you're doing over the course of time. Now, blood work, I believe, should be compared to healthy people and to the national average. So you have a disease perspective, and then you have the dis-ease perspective. Imagine in your mind going from right to left. Right is when you're born and you're healthy, and as you move towards the left, all the way at the extreme left is death, and in the middle is the different gray areas of dis-ease ending up as disease. So that's just how the body ages. And if you have different, tighter ranges of laboratory work that are designed to pick up problems in your blood work when they first start, as opposed to when they're much worse and they finally pop out of these ridiculously wide ranges based on average people, you might actually feel a lot better if you are treated based on information, particularly if appropriate, if you're treated with natural therapies like improvements in lifestyle, including but not limited to stress reduction, proper sleep, very little alcohol intake, not smoking, taking the correct nutrients, vitamins, minerals, herbs, foods based upon your blood work. Now, laboratory work should always be considered in context with your health goals. If you want to run a marathon, if your goal is to recover from cancer, to reduce the effects of chemotherapy, to get rid of your migraines, to deal with your psoriasis or eczema, your intolerance, to food, to gluten, for example, your infertility, your digestive problems, your depression, you name it, it's important to test for issues in the chemistry that may predispose to those problems, because certain laboratory abnormalities may mean more or less depending on what symptoms are actually persistent in the person, and also what their health goals are, because if you have these issues that I just mentioned and others, your nutritional needs change dramatically. The nutritional needs, and therefore the optimal laboratory results for different people, are different. So a person, I believe, should be compared to themselves over time. Repeat comparative testing in the context of their health history, their current health problems, and their health goals at the very, very least. And then there are other non-blood tests, which we don't have time to discuss today because our show is almost over, that are important to, more or less for different people, and they vary from person to person. That should be considered too, like a body composition test or a sonogram bone density test, whatever that person needs to include in the total picture to figure out a health plan for them. So if you'd like more information about what I call my Blood Detective Longevity Program, go to www.blooddetective.com or intnedny.com, or call us at 914-242-8844. And thank you so much for joining us today. And we'll see you next time with another exciting topic, but you'll have to tune in to find what that is. I'm Dr. Michael Wald, and I'm the Blood Detective. Have a great day.